geographically aligning the supply chain. So the air bridge, we had 3 additional flights come in today, bringing 1 million gowns, 2.8 million N95 masks, 2.8 million surgical masks, 11.8 million gloves, 18.6 thousand gowns on 3 flights. And that material will be pushed out across the nation, delivered to hospitals, nursing homes across the country. Dr. Bricks went through the geography, and so over the last few days, I've been aligning the supply chain to those areas, and then reaching down into those areas and extracting data from those areas on PPE burn rates. So, for example, I spent the weekend talking to the Chief Operating Officer of Detroit, Hakeem Berry, for example, then talked to the leadership at Detroit Medical Center, Audrey Gregory, talked to the health officer in Oakland County, Michigan, and then also with the Chicago health officer, Dr. Allison Arway. So reaching down to a level to understand their needs. So we're geographically aligning the supply chain. Right? So you can see Dr. Bricks went through these counties, and we're getting down to the county level. And then aligning it by priorities of point of care. Public hospitals first, VA hospitals, private hospitals, nursing homes, first responders, acute care. So over the coming days, we will be making a push to the geographic areas that Dr. Bricks mentioned, increasing the volume through the supply chain to those areas to give them weeks, not just days worth of supply. Primarily using our industry partners that we are directing, Cardinal, McKesson, Medline, Owen Minor, Henry Schein, Concordance Healthcare, directing them to put product to the hospital door, the nursing home door, the first responders, directly to them. We're also working to push out millions of doses of hydroxychloroquine. Right, we are working the distribution there to push the same thing to the same impacted areas, working it to get in the hospitals and to every pharmacy. And so my team is back there right now, working the arrangements to make that to the hospital front door and primarily to the local pharmacies, so doctor can write those prescriptions and you can get it prior to having to go to a hospital.
Great job. Thank you very much.
Thank you, Mr. President, Mr. Vice President. My last appearance here, I mentioned that the President had given the Department of Veterans Affairs very specific instructions to be as aggressive as possible in response to the virus crisis, and not only to protect veterans, but also to help the American people. As many of you know, we have 3 primary missions at VA. One is to support veterans' health, the other is to provide veterans with benefits, and the third is memorial services. But we have a 4th mission, and that is to support the nation in times of national emergency, both in war and in peace. We provide a bridge from the federal government to the states and localities during these emergencies. As a result of that, I have ordered our veterans' hospitals to begin preparing more than 1,500 beds to make them available both at the ICU and the acute care level to the states and localities across the country. As a result of that, we have opened up approximately 100 beds in the metropolitan New York area, in Brooklyn, and in Manhattan, and East Orange, New Jersey. We will be informing the governor of Louisiana, John Bell Edwards, tomorrow that we will give him access to our VA Medical Center in Shreveport, Louisiana, to come to the aid of the people of the Pelican State. I've also given instructions to initiate the 4th mission in Michigan. we will be providing the people of Michigan access to hospital beds in both Ann Arbor and in Detroit. We've also provided a pharmaceutical trailer to be used by the governor of Michigan at Cobo Hall to support the citizens of Michigan who will be coming into that facility for medical care. We have also informed the state Commonwealth of Massachusetts that we will be helping them in their efforts to protect their most vulnerable citizens in 2 of their nursing homes. So, in accord with the President's instructions, the 400,000 men and women of the Department of Veterans Affairs are in this fight. We are in the fight not only for the 9.5 million veterans who are part of our service, but we are in the fight for the people of the United States.
Thank you.
Thanks.
Thank you, Mr. President, and